What if I told you that your body after 60 can still deliver powerful, satisfying solo experiences, but only if you know the right way to do it? The difference between pleasure and discomfort at this age can come down to just a few overlooked details, and missing them could even put your health at risk. I'm sharing this from a urologist perspective, so you'll know what's safe, what works, and when to get checked. As men age, the body changes. Testosterone levels naturally decline, nerve sensitivity decreases, and erections may take longer to develop or feel less firm. But masturbation is not off limits after 60. In fact, it can be a healthy part of keeping your sexual function strong. The catch is, the same habits you had at 30 might not give you the same results now, and in some cases, they might even cause more frustration. And here's the twist: there's one technique most men over 60 have never even tried, yet it can instantly make the difference between struggling to finish and reaching intense, lasting satisfaction. The first key is to accept and adapt to your body's changes, because fighting them is the fastest way to frustration. Every shift you notice in your erections, your stamina, or the way pleasure feels isn't a sign of decline, it's your body speaking a new language. Slower erections. That's not weakness. That's your body asking for more connection, more warmth, more build-up. Different sensations. That's not loss, it's opportunity. Think of it as a new roadmap, with hidden routes you've never explored before, leading to the same, and sometimes even deeper pleasure. In fact, a 2019 study published in the Journal of Sexual Medicine found that men over 60 who adapted their sexual techniques, taking more time, using different forms of stimulation, and focusing on whole-body arousal, reported higher satisfaction than men in their 30s who stuck to routine methods. The key isn't chasing what you once had, it's embracing what you have now. When you work with your body instead of against it, everything changes. Not only can you experience stronger orgasms and improved mood, but you also boost circulation, support prostate health, reduce stress, and maintain erectile function longer. These aren't small wins, they're long-term investments in both your sexual vitality and your overall health. And the best part? You'll enjoy them without feeling rushed, pressured, or out of sync with your own body. But once you've embraced these changes, there's something else, a small but critical factor, that can instantly decide whether the experience leaves you drained or completely satisfied. Most men overlook it, and when you hear it, you'll wonder how you ever went without it. With comfort in place and lubrication removing every trace of friction, the next key is mastering the slow build technique. This isn't about dragging things out for the sake of it, it's about giving your body time to fully awaken. At this stage, blood flow takes longer to reach its peak, and nerve endings respond best when stimulation starts soft, steady, and deliberate. Begin with gentle strokes, focusing on warmth and sensation rather than rushing to intensity. Gradually vary your pressure and rhythm, paying attention to what feels best in the moment. This not only increases arousal but also allows your pelvic muscles and blood vessels to open up, making erections stronger and more sustainable. Don't limit yourself to the shaft. Explore the perineum, the inner thighs, even the nipples, areas rich in nerve endings that can send signals back to the brain, amplifying pleasure without extra strain. According to a 2018 study conducted in Italy and published in the International Journal of Impedance Research, men who incorporated whole-body stimulation into their routine reported deeper orgasms and a more satisfying overall experience. And here's where most men over 60 miss out. When you combine slow progressive stimulation with these overlooked areas, you're not just maintaining arousal, you're priming your body for a surge that can feel more intense than anything you've experienced in years. And here's the interesting part: when comfort is dialed in, it creates the perfect foundation for a small addition that can dramatically increase pleasure without adding any extra strain. When your body is comfortable and relaxed. The next upgrade is lubrication, and at this stage in life, it's not optional. As we age, the skin naturally becomes drier and more delicate, and friction that felt fine at 30 can now cause irritation or even tiny skin tears. Lubrication removes that barrier, turning what could be uncomfortable into something smooth, warm, and intensely pleasurable. Water-based lubricants are light, easy to clean, and safe with any toys or condoms. Silicone-based options last longer, feel silkier, and are perfect if you don't want to stop mid-session to reapply. Avoid oil-based lubes if you're using condoms, as they can break down the material. A little goes a long way, but the right type can make the difference between a session that feels like work and one that feels effortless. A 2020 review in Sexual Medicine Reviews found that older adults who used lubrication regularly reported greater sexual satisfaction, less pain, and more confidence during sexual activity. It's a simple tool with big benefits, and one of the easiest changes you can make to keep pleasure consistent and stress-free. Now that your body is comfortable, supported, and free from friction, the stage is set for a technique that can turn slow build-up into a wave of intensity you haven't felt in years. And if you want to make sure you don't miss that, hit subscribe, because the next part could change everything about the way you approach pleasure after 60. With comfort in place and lubrication removing every trace of friction, the next key is mastering the slow build technique. This isn't about dragging things out for the sake of it, it's about giving your body time to fully awaken. At this stage, blood flow takes longer to reach its peak, and nerve endings respond best when stimulation starts soft, steady, and deliberate. Begin with gentle strokes, focusing on warmth and sensation rather than rushing to intensity. Gradually vary your pressure and rhythm, paying attention to what feels best in the moment. This not only increases arousal but also allows your pelvic muscles and blood vessels to open up, making erections stronger and more sustainable. Don't limit yourself to the shaft. Explore the perineum, the inner thighs, even the nipples, areas rich in nerve endings that can send signals back to the brain, amplifying pleasure without extra strain. According to a 2018 study in the International Journal of Impotence Research, men who incorporated whole-body stimulation into their routine reported deeper orgasms and a more satisfying overall experience. And here's where most men over 60 miss out. When you combine slow progressive stimulation with these overlooked areas, you're not just maintaining arousal, you're priming your body for a surge that can feel more intense than anything you've experienced in years. Once your body is fully engaged, it's time to bring the most powerful sexual organ you have into the experience, your mind. Erections, arousal, and orgasm are as much brain-driven as they are physical. Without mental engagement, even perfect technique can feel flat. Tap into erotic memories, fantasies, or stories that excite you. Visual cues, audio erotica, or even sensual reading can trigger a cascade of neurological signals that heighten physical sensation. This isn't just psychological. A 2017 study in the Journal of Sexual Medicine found that mental arousal significantly increases activity in the brain's pleasure centers, which in turn amplifies nerve sensitivity in the genitals. Breathing is another overlooked tool. Slow, deep breaths keep your heart rate steady, improve oxygen delivery, and help your body stay in a state of calm arousal instead of rushing toward climax. This prolongs pleasure and gives you greater control over when and how you finish. The more your mind is in sync with your body, the more every touch feels magnified. And when mental focus and physical stimulation align, what follows isn't just an orgasm, it's an experience that feels richer, more intense, and more deeply satisfying than you thought possible. Once your body and mind are working together, the next enhancement is using tools designed to make pleasure easier, stronger, and longer lasting. Sexual aids aren't a replacement for natural stimulation, they're amplifiers. At this stage of life, even small boosts in stimulation or blood retention can make a big difference. Penis rings, for example, help trap blood in the shaft, making erections firmer and more sustainable. Strokers and sleeves provide textures and sensations that hands alone can't replicate, allowing you to explore new types of pleasure without extra physical effort. Vibrating devices designed for men can stimulate nerve endings more deeply, especially in areas like the perineum or along the shaft, where sensitivity may have decreased over time. A 2021 review in Sexual Medicine Reviews reported that men over 60 who incorporated sexual aids into their routine experienced not only greater sexual satisfaction, but also improved confidence and reduced anxiety about performance. Beyond pleasure, these aids offer multiple benefits. They can improve blood circulation in the genital area, which supports erectile tissue health over time. They allow longer, more satisfying sessions without physical fatigue. They expand your range of sensations and techniques, keeping intimacy exciting. They help reduce performance pressure by shifting focus from getting it up to simply enjoying the experience. And they encourage sexual variety, which research shows can increase long-term sexual satisfaction. These tools are not just for experimentation, they're investments in your sexual wellness and confidence, and because they're available in discreet, easy-to-use designs, they fit seamlessly into your routine without disrupting intimacy or spontaneity. And when you've got these working for you, there's still one critical safeguard that can make the difference between years of worry-free pleasure and an unexpected wake-up call. No matter how skilled you become at adapting your routine, you need to know the difference between normal changes and warning signs that shouldn't be ignored. Your body has its own way of sending alerts, and listening to them can protect not just your sexual health, but your overall well-being. If you find that erections are persistently difficult to achieve or maintain, even with stimulation, it could be more than just aging. Sometimes it's an early sign of cardiovascular issues. A sudden and unexplained drop in sexual desire can point to hormonal imbalances that need medical evaluation. Pain, swelling, or unusual discharge during or after masturbation should always be checked by a healthcare professional. Numbness in the genitals or surrounding areas may indicate nerve-related problems that won't resolve on their own. And if an erection lasts longer than 4 hours, a condition called priapism, it's a medical emergency requiring immediate attention. Chest pain, dizziness, or shortness of breath during sexual activity are also red flags that must never be ignored. These symptoms can be linked to underlying heart conditions and should be assessed right away. Knowing when to push forward and when to pause is part of mastering your sexual health after 60. Recognizing these signs early can help you address problems before they become serious, ensuring that your pleasure remains safe, consistent, and sustainable for years to come. Your pleasure doesn't have an expiration date, and with the right knowledge, it can be better than ever. If you found this valuable, make sure to like, share and subscribe, so more men can keep their health and confidence strong.